What's up?
Vitamin B12 is animal-derived protein. Usually we get vitamin B12 from animal products like meat and eggs. Once vitamin B12 income to our oral cavity, salivary glands secrete so-called air binder protein that rapidly binds to vitamin B12, and this results in formation of air binder vitamin B12 complex. And then this complex comes into the stomach. The major idea why we need air binder protein is to protect vitamin B12 from hydrochloric acid in the stomach. Because without air binder, vitamin B12 cannot survive in such an aggressive environment. At the same time, parietal cells in the stomach produce intrinsic factor. Then both air binder vitamin B12 complex and intrinsic factor income into the duodenum. In the duodenum, pancreas produce proteases, and proteases cleave air binder from vitamin B12. Once vitamin B12 becomes free, intrinsic factor immediately binds to vitamin B12, and now complex of intrinsic factor and vitamin B12 comes into the ileum, where this complex is absorbed by enterocytes of the ileum. And once vitamin B12 income to our blood, vitamin B12 is delivered to the liver, and liver is the place where we store vitamin B12. The most common cause of vitamin B12 deficiency is pernicious anemia. It's a condition where autoimmune reaction causes destruction of parietal cells of the stomach. Without parietal cells, we cannot produce intrinsic factor. Without intrinsic factor, vitamin B12 cannot be absorbed, and without income of vitamin B12 by absorption, vitamin B12 level will progressively decrease. Also, vitamin B12 deficiency can be caused by vegan diet. Because without animal-derived products, we cannot consume sufficient amount of vitamin B12. And obviously, in this case, income of vitamin B12 into the organism will decrease.
Anyone can be vegan.
Ovo-lacto-vegetarian, maybe.
Over what?
I partake not in the meat, nor the breast milk, nor the ovum of any creature with a face.
Short answer, being vegan just makes you better than most people.
Bingo.
Another cause of vitamin B12 deficiency is chronic pancreatic insufficiency, in case of chronic pancreatitis, for example. In pancreatic insufficiency, pancreas cannot produce enough amount of proteases, and without proteases, we cannot cleave air binder from vitamin B12. As a result, intrinsic factor cannot bind to vitamin B12, and without intrinsic factor, vitamin B12 cannot be absorbed, so this will cause decrease in vitamin B12 level. Because vitamin B12 is absorbed in the ileum, damage to the ileum can decrease vitamin B12 absorption, which is the case in Crohn's disease. Crohn's disease can affect entire GI tract, but most commonly, Crohn's disease affects ileum, and damage to enterocytes of the ileum will decrease the absorption of vitamin B12. Thereby, it will cause decrease in vitamin B12 level. But vitamin B12 deficiency is very uncommon, and there is very simple reason. We have huge stores of vitamin B12 in the liver, so it takes years to develop vitamin B12 deficiency even in the presence of a risk factor.
Okay. Fine. Yep. Ciao. What's that mean? Ciao. It's Italian. Means food.